Skin cancers broadly can be divided into two main categories. We have the non-melanoma skin cancers and as well as melanomas. But the more common one that we actually see are what we call non-melanoma skin cancers. And broadly speaking, there are two main types that we see. One is known as the basal-cell carcinoma, BCC for short, and the other one is the squamous cell carcinoma, SCC for short. BCC by large is by far, I would say, is the most common among the two which I mentioned earlier. And they commonly occur in the head and neck region. In fact, 85% of the cases that we see are usually located on the head and neck. And BCC, the risk factors for the development of this is usually due to excessive sun exposure, but genetics also play an important role. So in certain individuals, especially in the Caucasian population, they are predisposed to the development of this type of skin cancers. So we usually do this what we call skin cancer screening to make sure that we don't miss any of these potentially treatable conditions. By and large, I would say that anything, a new spot that's developing, if a lesion that constantly breaks down, you get an ulcer that's not healing well, or there's a presence of a bleeding lesion, okay, it's important to seek medical attention. If anything that is growing or changing in shape, color or size, it's also important to seek a medical opinion to make sure that you're not missing a skin cancer that is developing. For the dermatologist, we do look at a few features. We look for the presence of asymmetry in terms of the color, asymmetry in terms of the shape. We do look at the dimensions. We do look at the margins. This helps to give us an idea of whether the lesion that we are dealing with is something sinister and therefore need further intervention. We also do use a dermatoscope to help to give us a better appreciation of the lesion that we are dealing with. They give us greater confidence in determining whether is that lesion cancerous or benign in nature. You don't need to have pain or itch or any symptoms in a sense, okay, for the lesion to be cancerous. So if you do have any doubts or any suspicion that something is not right, okay, do not sit on it, okay. It's important to always see your doctor and have it checked and then determine whether there's a need for further intervention. End of the day, to reach a definitive diagnosis, we will still need to do a biopsy. A biopsy means we actually have to take a bit of the skin specimen out and have it look under the microscope and to determine the cell type that's present, to determine whether the cells present are cancerous in nature, and also to in a way grade the tumor to determine whether it is considered as a very aggressive tumor or a slow growing tumor. So this will help in subsequently to determine the management plan for the individual. There's a variety of treatment that's available for skin cancers, but the bottom line is we need to know what are we dealing with first. For example, even for basal cell carcinoma, it doesn't mean that we definitely need to have surgery. Like in the superficial type of BCC, we can actually give certain creams or even just cryotherapy or liquid nitrogen treatment will be sufficient in the treatment of these individuals. But I would say the gold standard treatment end of the day will still be surgery, but there are two different types of surgical options for the individual. One is known as Mohs micrographic surgery, and the other one is known as a wide excision or standard excision. The wide excision, what we do is actually just to cut out the tumor with certain margins, okay, based on literature, the medical literature guidance, to give us a statistical confidence interval for clearance of the tumor. The Mohs micrographic surgery give you greater cure rates, I would say. Based on the literature itself, we can actually reach about 99%. The reason for most micrographic surgery is a high success rate is the fact that you actually trace out the tumor. The surgery is done in a very special way. The tumor is removed in a certain way and processed in a certain way, just like peeling off the onion skin. and we examine the tumor margins. All 100% of the specimen margins are actually evaluated in this case down here, the deep margins as well as the peripheral margins. And this gives you an ability to actually trace the roots of tumor, and if there's any tumor found to be left behind, we can then go back specifically to the area that we determine the tumor to be there, to remove more tissues, and this allows us to trace the tumor until the roots are completely taken out. So in this case, what happened is that for most micrographic surgery, we not only trace out the roots of the tumor, but we also talk about tissue conservation. So we don't need to cut out a wide margin to ensure clearance, and this is very essential for certain areas where the tumor is found, especially what we call cosmetically sensitive areas like around the eyes, the nose, the lips, or even the ears, so that we can preserve as much tissue, and therefore we don't cause too much damage to the individual's cosmetic appearance. One of the main trigger, end of the day, is still sun exposure, the ultraviolet radiation. So it's important that individuals do exercise caution when going under the sun. One of the reasons why we are actually encountering an increase in skin cancers around the world is actually because of the change in the lifestyle of the individual. More people are actually adopting activities in the sun. More people are actually thinking that the tan look is supposed to be more healthy, and they like to spend more time under the sun. Another thing is that people think that with the use of skin sunscreens, okay, they can actually go under the sun for longer periods of time because now they have the protection. So a lot of misconception, and this has actually led to a rise in the prevalence of skin cancer around the world. So one important thing is that try to avoid going under the sun, okay, during the hottest period of the day. In Singapore setting, it's usually between 10 to 4. And also when you go under the sun, you need to use sunscreens, and you need to apply about half an hour before you go under the sun, and for every 2 hours that you're still in the sun, you need to also apply the sunscreen to give you the necessary protection. If you can also possible carry an umbrella, wear a white brim hat, or even wear long sleeves to give you necessary protection. So by and large, this is one of the ways in which you can actually do to minimize the risk of sun damage, which would then trigger skin cancer formation.